Hi, good morning and welcome everyone to County Executive Pittman's virtual press conference. This morning, the County Executive will share updates on the county's recent surge in COVID hospitalizations. We'll take questions after the updates. As a reminder, please put your name and media affiliation in the chat and I'll call on folks for questions in that order. And please keep your microphone and camera off unless you're called on to ask a question. With that, Mr. County Executive.
Thank you, Jeff. Good morning. Thank you for joining us. I want to start out talking about COVID hospitalization rates in our county. As most of you know, there have been no case rate statistics coming from the state of Maryland due to the computers being down there, and that stopped on December 3rd when our case rates were about 21. We have all known that with the holidays and the colder weather that case rates have likely been increasing. We just don't have numbers. What we do know is that hospitalizations have increased drastically in the last week in Anne Arundel County. They have doubled. They were about in the 40 range for most of the fall. They had gotten down below 10 during the summer. And now we have 84 hospitalized COVID patients in our hospitals in Anne Arundel County. A 1 week doubling of that number is obviously a cause for great concern. The situation in our hospitals, the labor force issues have not changed since this pandemic came. In fact, they've probably gotten worse. And so both our hospitals and our EMT providers at our fire department are under a level of stress that is really unacceptable in my view. And what makes it unacceptable is that these are preventable hospitalizations, these COVID hospitalizations. The vast majority of them are unvaccinated people who chose not to get the vaccine, and they're younger than the folks that were being hospitalized early in the pandemic. And you know, it's been talked about so much that the work has been done by this county and this state and all across the country to get more people vaccinated. And we're still stuck with about 20% of our residents, of our people who are eligible, making the decision that they are not going to get vaccinated. They have not been vaccinated, and nothing that we've done so far has convinced them. And I just want them to think about the situation in the hospitals and the situations for our EMT folks, that when people are taking up space in the hospital and taking up staff time in the hospital, on already overstressed hospital system, that it means that others wait and others spend hours waiting to try to get in. And that's an unacceptable situation. So I'm asking everybody not only to get vaccinated, but anybody that you know that's not vaccinated, please try to talk to them. This is not political. You know, Governor Hogan said, wear the damn mask. If I knew that this were an all adult listeners on this press conference, I would probably say, you know, something with a lot stronger language than that, but I will say, get the damn vaccine and just do it. So I can't think of anything else to say that is stronger than that. I know that our team at the health department will continue, and everybody in county government will continue to do all that we can to make these vaccines available. You can go to aacounty.org/COVIDvax. It's the only way that we know that we can end this pandemic. And none of us want to see the governor forced to have to do another stay-at-home order or close down businesses. We want to end this pandemic. We all do, and we know how to do it. So please get vaccinated. I have a couple of other things that I want to touch on briefly, and I do want to turn it over to both our health officer and our fire chief, Trish Wilford, who's with us to talk about some of the impacts of this. But first, I want to say that I delivered the State of the County address. It's online. You can see it at AA County, at AA County Exec on Facebook, also on the county's YouTube. And it's a pretty optimistic view. It's a pretty positive view of the state of the county, our fiscal condition, the work that's been done on public safety, the work that's been done on health, and particularly mental health that we're doing, and on land use. So I encourage people to take a look at that. It's about a 14-minute video. The land use side of things, on Saturday, we had our first of our stakeholder advisory committee meetings with the planning department for this new system that we have in Anne Arundel County, where we've transferred power to communities. There are 9 regions now, and 3 of them are starting the plan that is really going to define the future of those communities. And that was a fantastic meeting. I'm going to be announcing the chairs of those 3 regions, regions 2, 4, and 7, in the coming days. And that work is underway. And really, there's nothing more important for the future of this county than that work on our region plans. And then we have started to distribute the checks. Our team at Workforce Development is distributing checks to the contractors, the bus companies that do our school buses for our students. And we needed to get those contracts signed by the companies. That's been done. All the legal work has been done. The funds go directly to the companies and then to the employees. They will have them in advance of the holidays. And we want them to know that that's not the end of the conversation, but it's the first step that we can take and the fastest step that we could take to address the shortage. And we've started to see some indications that hiring the pace of hiring is picking up. Folks are applying for these jobs, and we're working to get them through the pipeline to get them onto those buses to get our kids to school. And then one final thing, I think there's a release that's gone out this morning or will go out today. Our board at Arundel Community Development Services, that does our affordable housing work and a lot of work in communities, most underserved communities in the county, has done a national search to replace Kathleen Koch, our longtime executive director, and they found the best person in the country to do that job right here in Anne Arundel County in the agency. Aaron Karpowitz will be taking over at Arundel Community Development Services. So that's great news. We were all pleased to hear that. So I am going to pass it over to Chief Wolford to give us a sense of what it's like on the front lines during this surge in COVID hospitalizations.
Good morning. Thank you, County Executive. There's really 2 reasons that someone becomes a fire chief, and there's 2 roles that we significantly own in every day of how we do business, and it's to serve and protect the public, and it's to serve and protect my members. And when we're looking at members that are struggling for the past 2 years, all of my firefighters and EMS clinicians, that's EMTBs, that's paramedics, that's my career and volunteer folks, we're seeing tremendously long wait times at the hospital. And for somebody that has sworn to serve and protect, all they want to do is be in the community and serve. And when you're waiting hours at a hospital because you have a patient that is sick, or because you have a patient who maybe didn't utilize other resources, and they felt that their only answer was to go to the hospital, it can be discouraging and heartbreaking that we feel helpless, because the one thing that we want to do is help. And I say this in great partnership with our hospitals, but the hospitals are struggling. For 2 years, we've worked diligently as nurses and paramedics to try and take care of folks. We still have a regimen of full PPE. Anytime we enter a home, we're still putting on the gowns, we're still putting on the face mask, we're still running the PUI calls. And we would hope to see that less and less the more our community is vaccinated. It would be encouraging to my staff and my folks to know that maybe somebody that has COVID has been vaccinated and they're going to treat it at home like a common cold, instead of somebody that has, gotten COVID and has not been vaccinated. And my paramedics are wondering, am I going to have to intubate them in the back of the medic unit on the way to the hospital? Am I going to have to worry about what's going to be the next level of EMS care that I can provide? And then the staffing at the hospital where they are absolutely struggling. Are there going to be enough nurses and doctors to take care of folks? And the answer right now is no, right? There's not. There's a huge mental health component to this, the worry that my firefighters bring home to their families. And so after 2 years, we will continue to stay in the fight because that's what we do, because we want to help, because we want to serve and protect. I think if there's a request as a fire chief, it's do the right thing for your community and your neighbors, do the right thing for my firefighters and my paramedics who are really struggling right now. And we're just asking that everybody consider being vaccinated if you're not. Consider using the hospital systems for the right means. The waits are incredibly long. We bring patients in the back door through the ambulance, and you'll end up in the waiting room because there's just not enough people to go around. There's not enough people to help. And when they're at the hospital for multiple hours, it's heartbreaking that they can't be out in the community. The more people that are at the hospital, the more providers are at the hospital, which means that's less providers on the street taking care of our community. And there's only so much staffing to go around. We all see the staffing shortages. So from somebody who has raised the right hand to serve and protect, and as a paramedic myself who is still out in the field sometimes, my request is that you try and do the right thing, and you lean forward to protect my members and to protect your neighbors.
Thanks, Chief. Dr. Kalyana Raman.
Thank you, County Executive, and thank you, Chief Wolford, as well. So I want to just give a little bit more context for what we're seeing in terms of the severity. We've, as County Executive noted, we've been seeing this increase in hospitalization of the past few weeks. It's been rising pretty steeply. A couple of weeks ago, had about 41. This was on November 30th. And 2 weeks later, we had 84 people hospitalized between Anne Arundel Medical Center and Baltimore Washington Medical Center, over 100% increase. And we're seeing a steep rise in the state as well. And it's the most people we've seen hospitalized since April, which is concerning because we're moving further and further into cold and flu season. Cold weather is here. And we talked about this, that COVID is going to spread more easily. In our conversations with the hospitals, what we're finding is that people who are unvaccinated, they continue to be the majority of admissions. People who are vaccinated but have other conditions are also getting hospitalized because it's circulating so much. The areas that they're seeing the most admissions from are Glen Burnie, Pasadena, and Annapolis, something to be mindful of in terms of talking to your neighbors or friends, if they're from that area, to get themselves vaccinated, to get themselves tested. But I think it's really important to talk about what this looks like. It's not just people are getting sick. We're also putting a lot of stress on the nurses, doctors, techs, and all the hospital staff who take care of each and every one of us. As Chief Wolford noted, our EMTs are feeling that burden as well. We're asking them to be there for us to manage COVID, and they've been doing that for a couple of years now. But they do this in addition to everything else they do every day. This isn't something that they do that displaces that other work. It is on top of. And we really can't take their care for granted. Really, each of us does need to do more to be there for them. The more layers of protection each of us use, the safer we will be, and the less stress we'll put on our healthcare professionals and hospitals so that they can be there safely for us. The good news is we know what we need to do. The hard part is that we have to consistently do it. And during the holidays, it's not something that we want to think about, but the reality is that COVID doesn't care what we want to think about. So I think the more we do to protect ourselves and just kind of make it a part of our routine activities, the better we're going to do over the holidays. And it comes down to those really core principles that we know: vaccines, masks, testing, right? With vaccines, get your first shot of COVID vaccine if you haven't already done so. Yes, over 80% of people who are 12 and over have gotten a shot, but that still leaves over 20% of people who haven't. And they are overrepresented in the folks who are being hospitalized, but it's also spreading. We've also got a chunk of people who have gotten only one shot of Pfizer or Moderna, didn't get their second shot. Get your full protection. Get your second shot. And then if you've gotten both of those shots, or if you got Johnson & Johnson, get your booster shot. What we're finding is that after about 6 months of Pfizer and Moderna, that protection starts to diminish, just like it does with the flu shot. Get your booster shot. Get it now. Wear a mask. That's the second piece. Wear a surgical mask, wear a multi-layer cloth mask, make sure it covers your nose and mouth. We all see those people where it hangs below their nose. It's useless when you let it hang below your nose. Put it over your nose and your mouth. And if you see somebody, say something. The other piece is wear your mask when you're indoor public settings or crowded outdoor areas. And there's a lot more crowding outdoors, right? As we're all going out, there's Christmas tree lightings, there's events, there's holiday festivals, all sorts of good stuff. But be mindful that whether you're vaccinated or not, wear your mask when you're around a lot of other people. And then testing. If you're sick or have symptoms, stay at home, whether it's from work, school, going out, gatherings, and get yourself tested. We obviously have some at-home tests in our libraries and other areas. We'll be getting more out next week, just in time for the holidays. It's really important. Test yourself. It's easy. It's simple. Frankly, I've done it. It's a great way to make sure that you're protecting others. Businesses and organizations have a real role here too. Protect your staff. Make it easy for them to get the vaccine, required if you can. Make sure you're providing masks to staff and customers. Make sure your ventilation standards are optimized, and give your staff time to take off when they're sick. And I think lastly, spread the message. So on that front, we are launching a social media contest for 5 to 17-year-olds. It's a collaboration between the Department of Health and the Office of the County Executive. And its goal is to emphasize why it's important for our kids in that age group to get vaccinated and to encourage others to do the same. And so we want kids to come up with their most creative video ideas about why you got vaccinated, or for adults, why your children got vaccinated. You can submit those videos anytime between December 14th, today, and Monday, January 10th. And there's a chance to win $250. We know that your voice, talking to your family, your friends, is very important. We listen to our friends, we listen to our loved ones. So spread the message. Put those safety measures into place so that you can have a good holiday, and be mindful about this holiday season. We can get ahead of COVID, but it's going to take work, and we need to protect not just ourselves, but our healthcare workers, our EMTs, who've been doing this work for a couple of years now. Jeff, back over to you.
Thank you, Dr. Kalyanaraman. So we've got a lot of incoming questions in the chat here. So folks, reporters, if you can please keep your initial list of questions to 2 per reporter as we go through it. We're tight on time. We're going to start with John Frenay, Ion Annapolis. And again, if you have questions, put your name and media affiliation in the chat.
Hi there. I've got, I guess, a question for Dr. K. And I was just reading that in Washington State, they're unable to discharge some patients from hospitals to care facilities, which is causing an overflow of the hospitals because of the staffing concerns at the care facilities. Is that a concern here?
That is something that we're keeping an eye on. We do know that that it's tight right now in terms of being able to discharge people to care facilities. But if we see more admissions, that's going to get tighter and may become a problem. That's exactly something we want to avoid.
And remind me again, what was the capacity of our hospitals? I know you said we've got 84 now, but what are our hospital capacity? How close are we?
Yeah, the hospital capacity, it's a little bit hard to pin that number down, because what they've had to do in the past is start to decrease outpatient procedures that require admission or go on diversion. And so that's always in flux. So I think a better way to think about this is the more COVID admissions we see, the less capacity they have for all the other routine care that they're providing every day.
Okay, great. And real quickly to the county executive, do you have any kind of an update on the bus contractor incentives and getting the buses back on the road?
Yeah, you might have missed that. They're passing out the checks. They started yesterday and today directly from workforce development to the contractors. And at least the contractors who have said they all had to sign agreements with workforce development before they could get going on that. But at least some of them will have those checks into the hands of their drivers by the end of this week, certainly before the holidays.
Do you know how many went to the existing drivers and how many were to new people?
I don't.
Okay.
Hey, John, we'll get back to that. Thank you. Bill Yakubowski, WBAL.
Hi there. You folks should be able to hear me, right?
Yes.
Okay, good. This is for the county executive. As far as the numbers that are coming from the state health department that have not been coming since the cyber attack, in your conversations with the folks at the state, what are you hearing as far as when those numbers are going to be available? And have they been able to manually give you the daily case rates? I mean, are you collecting case rates? How is that working? We're not getting a good update from them as far as at the county level. Just curious as to how you're collecting them, or is that just taken over by the state?
Yeah, we're not getting them manually or electronically for case rates. The only data that they're putting out that I know about is the hospitalization numbers.
And again, have you been able to get an indication as to when that's going to change?
No, we have not. There's been not much information coming out on that.
Okay, thank you.
Next up, Bruce DePoit.
Good morning. Thanks for taking my question. So do you have the hospitalization numbers for the entire state broken down by county? And if so, can you share them?
I'm gonna ask Dr.
Yeah.
to respond.
So the hospitalization numbers for the state are on the state website.
Okay.
Directly there. I don't know about the county breakdown. That would be for the state would have that if they have.
But you know your numbers from being in direct communication with your facilities.
Yes, we know our numbers for Anne Arundel County.
What impact is the lack of data having?
A couple of things. One, it makes it harder for us to communicate where we are right now, for people to know where we are right now. And the second, particularly, we were seeing our case rate increasing as of December 3rd, which is the last time we had data. So it's a little bit fuzzier as to what exactly is happening right now. So it makes it harder for us to make decisions and understand the context.
All right, next up, Kate Amara.
Hi, I'm going to follow up on that question. Well, I had asked Jeff to send me your daily numbers on Anne Arundel's COVID hospitalizations, cases, and deaths, but it sounds like of those data points, it's hospitalizations. Is that the only one that you have? Do you not have the daily COVID cases in Anne Arundel since December 4th and the daily deaths? And is that why it's making it hard for you to make decisions? And how much of this surge overall do you connect to the new variant of concern? I know you've been predicting this for a while, but are you able to say how much of it is connected to Omicron? Thanks.
So yes, we do not have case rates or deaths and that's directly related to the Maryland Department of Health issue. And of course, once we have that, we will share that. In terms of Omicron, we were just starting to see that a couple of weeks ago. The vast majority of this increase is due to the Delta variant. Part of our concern is that Omicron is in other countries has spread pretty rapidly, and so that's something that we definitely want to keep our eye on. But without the data, we can't comment on how much of this is due to Omicron.
And I'm sorry, I'm so shocked. I have to just follow up to make sure I'm clear. Since December 3rd, you as the health officer, you're having to make decisions about the pandemic with no data. You're like flying blind because you don't have the numbers in front of you of what the COVID cases look like right now. Is hospitalizations, that's what you're making your decision making off of? That sounds crazy. I mean, it's not your fault. I just mean you can't get those numbers yourself.
Well, I want to be clear about something. The hospitalizations are the main indicator that we're really looking at, right? Cases, the reason we're interested in cases is because it helps us understand what may or will happen in terms of hospitalizations. Right? the severity of this disease is what we're keyed in on. So having the hospitalization data does allow us to understand the severity. It's kind of, I wouldn't say we're flying blind. It's kind of like our vision is a little fuzzy, right? We don't know the case rate, but we certainly know that, between schools and reports from other labs, that cases continue to come in. We're just not able to give an accurate count of that. And so I don't want to suggest that we don't know what's going on. We just don't have the clearest picture like we did a couple of weeks ago, but we do know the trajectory that we're on.
But I would just add that it is concerning to have a doubling of our hospitalization in the last week and not know what our case rates look like right now. So the hospitals need to be able to plan for the future too. And not knowing what's going on with the case rates means that they can't project what their hospitalization rates are going to be in 2 weeks.
All right, thanks, folks. Not seeing any other questions in the chat. We're going to call that a wrap. See y'all next week.